All right. I wanted to share with you my story and how I became a physician. Because one of the things I often get asked is what it's like to work in an Aboriginal community. And I started thinking about this even before I got into med school. So maybe on your journey to become a physician or whatever you choose to be, it'll be an example for you to consider and plan your education and your experiences. So as I mentioned before, I'm a family physician. Been working now, I started practice in 2005 and been working, it's going to be my 10th year of practice, starting in July. So it's been an interesting journey, and it's amazing because when I interviewed and then got into med school, I'm doing exactly what I planned to be doing. Sometimes life may take you in different directions. You may not end up doing something you initially thought you might do and end up in a different direction, but that's okay. All our journeys are very individual, and que sera, sera. So this is where I work.
I think the batteries might be dying in it. It's been really dim in lecture the last little while.
Yeah. Anyways, I'm ready to share. Awesome, Jamie. The largest of 9 Creek communities that has a regional hospital, and it's a 29-bed hospital. So my practice, I did some locums when I first finished residency, and I did a 3rd-year emerge training because I knew I was going to work up in James Bay, so I wanted to be well prepared to work up there. And so I did actually training. So I had always thought about being a doctor since high school. And my first undergrad degree is biology. So I went to Western, and actually I was quite young. I was 17 when I started right after grade 13. And it was quite a culture shock because, you know, I went from a small town to a big community, and the full-time students at that time on campus was about 20,000. It's probably much higher now. It was just like a city within a city, and it was far away from home. So struggled a little bit with adapting to that, and later I got into party mode, and I was living in residence there, going residence, and it was fun. I still thought of being a doctor, but I realized now I wasn't ready for that, and I ended up with a C average with biology. Then I decided instead of working as a biologist or in a lab, I wanted to pursue something more meaningful and practical, perhaps. So I decided to be a nurse. And I went to Ryerson. At the time, it was not a university, it was a Polytechnic Institute. And I got my nursing diploma there. I even failed one of the courses that I needed to continue into the final year, so I actually ended up doing an extra year to finish that, and pulled up my socks, and I got my diploma, wrote my nursing exam, and became an RN. And I was an RN working 3 years in Toronto for the experience. So I worked at what was called Hospital, and then I moved to Ottawa, and I was working here at Ottawa General Hospital as a team leader on a surgical floor. So I actually nursed for 12 years, and in the meantime, while I was nursing, I actually went back to school and did my nursing degree here at Ottawa U. I worked mostly evenings, so I could go to school in the daytime, got very organized in my time to do that nursing degree and get good marks. And what drove me was my nursing experience. I learned to appreciate how medical students, residents, and physicians work to assess patients, decide what's going on, do lab tests, x-rays, whatever, and help that patient. And because I worked so closely with them, it really inspired me more that I wanted to do medicine eventually. So that's why I went back for my nursing degree. And I did really well. I was very organized. I actually made time for for my personal life as well. Even though I was very busy, I was working almost full-time and going to school full-time, and I ended up with a good GPA. So I really enjoyed my nursing career. I don't regret it any, at all. I think that was my journey, just sort of done that. And what's most important is I really enjoy helping people. I felt I could do more beyond nursing. But life happens, my twin sister passed away while I was finishing my nursing degree, and it was quite sudden. She had an aneurysm, and it was really enlightening for myself because I realized how short life is, and going through grieving with my parents and sisters and was, a part of life. The first time I had ever lost someone so close to me. But in actual fact, it made me stronger. It made me more determined now to realize my dream that I thought about in high school, and I wanted to become a doctor. So I started to look into what it takes to become a doctor, learning about the medical school programs. I met some Aboriginal physicians, and they gave me some advice on what it takes to apply to medical school, working on the autobiographies, getting experience, like volunteer experience, and starting the process of applying to medical school. So it took me a few tries to get in. Every year I applied to more and more schools. This is back in 1995 to 96, 5 to 98 when I was applying, and I was so determined. I applied to more schools every year, and in the last year I applied to American schools as well. I managed to do always well in the interviews that I was invited for, and but for the first, until I got into med school, I got on waiting lists for the schools that I interviewed at, and it was actually Ottawa and Calgary. And then what happened in my last year, I applied to 10 Canadian schools and 16 American schools, and by that time my marks were quite good, my GPA was good. I worked on my applications every year, improved it, did more volunteer work, plus working as a team leader. And it ended up that I got offered interviews for 4 different schools, 2 Canadian, 2 American schools, and I got offered admission at 3 of them, and the waiting list on the 4th. So it was just my time, I think, to get into medical school. But it took some years, of course, to build it up to that point and improve every year. And it really made me, as well, feeling more confident in myself when I did interviews, because the more experience you get being in an interview and sitting there and asking questions and interacting with the panel or whoever's interviewing you, it gives you more confidence. Even if you don't get in that year, it gives you more confidence to do well the following year. So it just happens to be that way. But what I find is that I gathered strength every year, persevered, and eventually I got into the school that I ended up being here at Albany. I actually was going to go to Calgary because I'm applied as a mature student, and I said, "Ooh, I'm getting older. I don't know if I want to be in med school for 4 years." But in actual fact, my dad had a little heart attack. And my parents said, "Well, you better stay in Ontario if you get in, because if something happens to my dad, it's easy to drive up to Ontario again." And I didn't hesitate. Obviously, they wanted me to stay close. In actual fact, it turned out to be a really good idea because I enjoyed my summers off. I worked as a nurse up in Chisasibi and made some money in the first 2 summers. And at the same time, I got familiar with the Quebec healthcare system, because I actually mostly trained and worked in Ontario. So it's been a bit of a long journey, but I think that was a journey that was meant for me. So in becoming a doctor, as I mentioned, I applied for a few years, didn't get in right away. I started med school in 1998, and the one thing I learned about was the hardest part about med school is actually getting into med school. And it depends on your marks, your MCAT that you mentioned, experiences in your life, like volunteer work, and other leadership kinds of experience and doing well in the interview. And most schools in Canada are 4 years, with Calgary and McMaster being 3-year programs. They actually, the difference between these schools is really the length of time, because at the end of the completion of an undergrad medical degree, you have to complete the same number of clinical hours, the same number of objectives for each part of the education, like the classroom part and the clinical rotation part. So it's really a condensed program. That's the only difference. And obviously the time off, you don't get 2 summers off like 4-year programs. You go essentially right through with very little time off, maybe a week at Christmas and another week or 2 during the rest of the school year. For residency, after you finish medical school, you write a licensing exam, Part 1, to get your Canadian medical license. And that's the objectives of the program's aim, so you will pass that licensing exam. Also in the 3rd and 4th year, when you're doing your clerkship rotations, that's the clinical rotations when you're in the hospitals working on the different specialty rotations. So you might do the surgery rotation, internal medicine, family medicine, obstetrics, gynecology. You have to do certain ones in the 3rd year and certain ones in the 4th year are more your elective time when you're gearing yourself to residency. So if you want to be a general surgeon, everyone does the same clinical rotations for the core part of the clerkship. And then the elective part of the clerkship rotations is what you want. You're going to gear yourself to what you want to do. So if you want to be a family physician, you might do a little emerge, a little bit of deliveries. If you want to be a general surgeon, you'll do more surgical rotations. And the goal is to get those experiences that will prepare you to apply for residency. So residency is the clinical training part of our career path. And this is when, after you graduate from medical school, you have your MD degree, you go on off and do clinical training and end up eventually writing a certification exam in your specialty. So the shortest one is family medicine, is 2 years, and you write a CCFP exam at the end of 2 years. So that's the Community College of Family Physicians, meaning you're a certified family physician. There are other specialties, general surgery, and there's different subspecialties of surgery like thoracic surgery, vascular surgery. For the most part, by the end of your surgical training and all the other specialties, you write the Royal College exam. So the Royal College is the body that certifies specialists. So anything from cardiology, internal medicine, psychiatry, obstetrics, gynecology, the different types of surgery, any subspecialties, basically. They're going to, specialties and subspecialties, they're going to be expected you to write the exam at the end of your clinical training. And this is called the FRCPS. Fellow of the Royal College of Physicians and Surgeons of Canada, RCPSC. So you get the initials at the end. But then you're certified as a surgeon, as a psychiatrist, as an internist. Neurosurgery residency is 7 years, the most required. Of course, they have to be very specialized to know how to do surgery on the brain or the spinal cord. So they get the general surgery training, and then they subspecialize in neurosurgery. It's a long process. And at the beginning of residency, we write the second part of the license exam. So that means you're licensed to practice in your specialty at the end of everything. But learning about medicine doesn't stop there. We continue on to maintain our certification and our knowledge and skills through continuing medical education. So myself as a family physician, I have to collect so many credits per year and keep a record of it to show that I'm maintaining my knowledge and skills. And the College of Family Physicians, which I'm registered under, monitors this. So it's the same thing with the Royal College. So whatever you end up doing, it's good to think about it early in your career about what you really want to do and how in medical school and in residency you gear your experiences and knowledge that you're gaining towards that pathway. So for me, obviously family medicine, I'm a physician now, I did the extra training in emergency. I enjoy working in rural and remote areas, did locums in northeastern Ontario, and now I'm working in a remote hospital. So I'm involved with the Society of Rural Physicians of Canada, and they're very receptive. Aboriginal health, of course, being Cree. I enjoy teaching about it and linking with other Indigenous physicians, and also training medical students and residents who come out to Chesapeake. We get McGill students and others out there. And what's great about that is we end up having a lot of them come back to work either as a locum or as a full staff. So the majority of my colleagues are from McGill. And they really appreciate the challenges we face up there, the remoteness. You know, sometimes we're doing medevac, sometimes we do the on-delivery. We have a lot of people with social issues or mental health issues. It could be anything from a very weird disease to dialysis to straightforward diabetes, but sometimes our patients are very simple to manage and sometimes they're very complex. So we get a lot of interesting medicine in working in the community, and that's what I like about it. It's very challenging, like academic-wise, and understanding that, you know, whatever I have trained to do has brought me to that place, but I'm always continuously learning. And that's what medicine is never the same every day. It's great. Face some difficult issues like telling a family about a bad prognosis, to helping with the delivery, and all the family women are around the woman in labor and the baby's born and you throw the baby on the belly and everyone's happy and crying, you know, so it could range from a whole different variety of experiences, but it's great. That's the nice thing about family medicine. But whatever you choose to be, you know, you're going to find joy and hard work and challenges in that career, but that's the great thing about medicine. It's never the same. It's always a great thing. It's quite the privilege to be helping people in the worst of times and in the best of times and anything in between. So I'm so happy that I'm a physician because I get to do all this. And lately my path has turned to administration and advocacy. So I think the experiences I've gathered over the years, being involved with escalating the medical student council here. When I started off, then I was involved with the residency association here in Ontario, and then involved in different councils like the Society of Rural Physicians. I'm on their national council, and I'm currently the president of the Indigenous Physicians Association of Canada. So you see in your packages that there's both a role model, and I'm the president there, and I have a president's association. It's things like these that keep driving me, even though I'm very busy. It's great. I wish I had a dog, though. I travel so much. I don't have a dog. But that'll come. So just some pictures. This is a little hospital in Chesapeake. Right now we're planning to get a new hospital. We've already been approved by the Ministry of Health in Canada. So it's a very small hospital now, but it's going to be a nice big one. My dad is from Chesapeake. My mom is from Skagamish on the coast. So it's nice to be back and working in my culture. These are some pictures from my residency I did in Timmins. It's actually a separate program, but we were in different places. So I spent the majority of my time in Timmins, and it was a great medical team there. Good teachers, worked mostly in the Merge, and I did a little work in Mississauga Aboriginal Health Center there. This is in Chesapeake, the medevac plane, one of the companies that comes. So you can see some of the equipment there. There's intravenous pumps on the top left, on the left side, or on the right side, and then the incubator on the left side. And one of my colleagues inside the plane, and Sometimes we're expected to go in the plane when we bring a patient because they're unstable or they're intubated or in preterm labor. And so some of but like I didn't learn that in med school, I learned that on the fly basically. But the main thing is when you're taking a patient, your focus is obviously on the patient and how critical they are, or sometimes they're fairly stable, it's not a big problem, but when they're unstable, it can be challenging. But the main thing is to get them there safely, and we have a good team there, nurses and doctors, to help each other out and bring that patient to the self-care that may be. Some of the other things I do, I go to conferences, I collaborate with other Indigenous physicians and even non-Indigenous physicians who are involved in Aboriginal health. So I'm at the Northern Ontario Medical School conference in UOttawa on the left side. On the top right, I was here I was in Victoria at the Cycle Physicians Conference with some of the Indigenous residents, two residents on the left there, and Darlene Kitty, who's a family doctor working in Saskatoon, and myself. And at the time, the president of the Canadian Medical Association, Anna Reid, she was president of the Canadian Medical Association that particular year. So we met up and we're talking with her in the booth. And this picture down here at the bottom is our Indigenous Physicians meeting in Saddle Lake in 2013. And here are our board. There's a couple members missing there, but our board is standing on the steps of Blue Quills First Nations College, which used to be an Indian residential school. So we're very proud of that picture and the fact that we had our annual meeting, a bunch of Indigenous physician students and residents on the former site of an Indian residential school. The skydiving picture was the day I graduated from med school. So I missed my grad. I was already in Australia in CARES, and I didn't tell my family I was doing obviously, they wouldn't let me. But when I came through, there was no Aboriginal program. And the first day of school, when you get into Ottawa, the thing you have to do is, the big tradition of the dean is to stand up and tell your story, who you are and why you're in med school. And so the day I stood up and I said, I'm Darlene Kitty, I'm a nurse, I'm from James Bay, and I want to be a family doctor and go back to James Bay. And I want to extend my nursing skills beyond and into medicine. But the way it came out was really funny because it thought I was poking fun at medicine as being glorified nursing. And the whole room broke out in laughter. So in my class I had 86 classmates. And the dean broke out in laughter, all the other big wigs of the school. And I realized right away, oh, that's not what I meant. People were laughing at me, but ever since that day, they never forgot my name through the 4 years. And so I made a lot of friends very quickly. And one of the faculty members came to talk to me at the lunch later on that morning, and he said, I really enjoyed your story. And I said, that's not what I meant. And he says, I know exactly what you meant, but it was still good. And in actual fact, that story came back to haunt me when we were graduating. So at Ottawa, they have this big grad day here for all the students, and it happens in May when everyone's going off to start residency. But in this time, I was in May, I took off for Australia right away. And one of the things I wanted to do was skydive. Because I felt like before I go on the rest of my journey in medicine, I wanted to do something wild, So I did. And then I got up, I landed. The guy was really good looking. Landed on the ground, and he gave me a big hug. And then I had to go catch this plane to New Zealand. And I was sitting there I didn't even watch the movie. I was just sitting there glowing. And then I realized, oh, I just graduated from med school, but I'm here. So I did it. And it's hard to explain the feeling, and it's because I achieved something that I wanted to do. And I'm so happy to be doing it now, even as I practice. So different things over over your career, you could be doing many things around our own country, but also other things. So I just came back from a conference in Taiwan on the right side there. And then 2 years ago, I was in Australia for another conference. So I thought, oh, you can make so many connections. There's this conference every 2 years, Pacific Region Indigenous Doctors Congress, and that's where we were 2 years ago in Australia, and then this past one was in Taiwan. And it's truly remarkable how these Indigenous physicians in other countries have so much similarities in Indigenous health issues. And if it's something that you want to pursue in your career, learning about Indigenous health, this is where it can take you. It's just a matter of what's your interest. And, of course, you balance that with your personal life. And, that's why I don't have a dog. I mean, just some of the things I do. Home care visit. This lady passed away a couple of years ago. She was so sweet. One of our patients from Great Whale, he's passed away now, but he was so happy to be treated by a Cree doctor. One of the things I quickly learned when I went back to practice was that I need to learn more about residential schools and Aboriginal health issues. And so I always teach about the 2 schools we have here in Saskatchewan on Fort George Island, just down the river from us, and how it still affects our people. And then my dad went to the Anglican school. So he's right here. And then he was a Boy Scout, actually. He's here. So even, it touches every family residential school, right? And I'm very proud of my dad that he survived his experience, and he seems to be doing well through life. But still, I always teach about others, how, people suffered. I always focus on the strength and resiliency of people as well. So some of my other family pictures is my great-grandmother on the top left. She was a traditional midwife. And my mom's family on the top right. My Uncle James, my Uncle Sam on the top bottom left. And then my grandfather here, he was a clergyman. So even the church is still important for people, even though they were the ones putting on these residential schools. So various things that I do. I work in the clinics that we have in community health clinic and our outpatient clinic, external health, and emergency. Work in the hospital ward, doing home care visits and these community health clinics. And the big thing was learning more and more about Aboriginal health. So we have to learn about evidence-based medicine, and so I try to learn the most from the academic data that are produced in Aboriginal health, and learning more about mental health and how to treat our patients with the various challenges that they have. Being on call for emergencies. So we also cover doctors, villages with no doctor. So the nurses assess the patient, then they call Chesapeake Hospital doctor on call, and we have to advise them on how to treat the patient. Sometimes we end up doing a medevac with that patient. So another thing I mentioned, I do teaching, working on committees, and other admin work, do research.
No. What's that mean? That means that the computer just crashed.
I should mention, if you come in the Aboriginal program, we hope that you're going to go back and work with an Indigenous community somewhere, but it doesn't necessarily have to be one really remote. Because eventually, life happens. Some people end up settling in the city, their partners, and they have children in the city. But we know that more and more Indigenous people are living in the urban centers. So you will see Indigenous patients no matter where you work. And, if you want to be a cardiothoracic surgeon, of course you're going to be in a big city because that's where the service is. For example, Sudbury has bypass surgery. But not the other smaller communities in northeastern Ontario. So one of the things I value most is being a role model. So I talk to Cree youth, sometimes like Cree women groups, students, residents, so it's whatever you feel is important to you, please go out and share that, even if you're not in medicine, to inspire others who follow in your footsteps. And one of the things I found I had to do was become more politically active and advocate. So I'm involved with the PriPAC, or Indigenous Physicians Association of Canada, but also in Northern Quebec, our region is called Region 18. And I'm president of the Conseil de Médecins Dentistes et Pharmaciens. And this is kind of like our medical council that houses the dental and pharmacist staff. And we, our mandate is to address the quality of care in each of our professions and make sure that there's good resources for the Cree Health Board. So I've had to step up after several years of practice and realizing we need more, and we need to educate our managers and senior managers. Then I end up becoming elected as president. So my path right now is more focusing on that, and I sit on the board of the Cree Health Board because I feel so strongly to advocate and improve things with my colleagues. And of course I'm doing academic work here as a director, and plus I'm on staff at McGill University. So I have my fingers in many pies, and for the moment it's very, very busy. But for me, it's good to work hard right now, and then I'll ease out of it after my terms are finished and stuff. So whatever you want to do, you can create your own path. If you're raising a family, maybe you just want to enjoy clinical practice for a few years before you start engaging in other things. So whatever you feel like doing, it makes your practice more interesting too. So for me, it's I really miss clinical practice, but I can't do too much right now. But in other words, in other ways, I'm still making a difference. If you go visit the Indigenous Physicians website, you can get some information about who we are and what we do. We're going to be revamping it, so you may not be able to get as much information, but certainly you can email us for any questions. My advice is not to put your eggs in one basket, to apply to more than one med school, not just Ottawa, although of course Ottawa is the best. And to come out to activities whenever you see things like this, or if you know any other students, post-secondary students who might be interested in medicine as a career, encourage them to come and check out our new med school. And just a few pictures. My aunt and uncle, we're one of our three families, little baby. Me on the right, we're going up the coast for a fishing trip. One of our Cree ladies cooking at a feast in our elders camp, a traditional winter shelter. The kids on Fort George Island, where our community used to be located before the hydroelectric development. Now it's scattered with old cabins and new cabins, and it's like a little city in the summer. My dad down the coast, sitting in a traditional goose blind. When he was a young man, growing up there with his family, the trees were very, very small. So when the Canada geese migrate, they had to create their goose blinds. So they made these little rocky nests and scooch down, and when the geese fly over, you just pop up and shoot them. And there you see all these little rocky nests down up and down the coast. The boys at our summer gathering, they were shy, and we were picture taking. The girls, twins, sitting on a boat. My cousin, we were going down the coast to do some fishing with nets. One of our walking out ceremonies, one of our Cree traditions. The little girl walks out of the teepee, touches the ground for the first time. And she carries her traditional wear and is welcomed into Cree society in the traditional sense. Women cooked and chopped wood and kept care of the fire, and they're welcomed by elders who preside over the day. There's a breakfast served by the mothers, and all families gathered inside the teepee after, and you have to burn that wood in the wood pile, and then there's a big feast at the end of the day. And there's always cake. big families. Some of our traditional wear is one of these traditional activities in our community. This is our summer gathering, fiddle dancing and fiddle music and square dancing. It's a teepee just near the La Grande one dam. Going up for summer boat ride. Brook River, East Bay. I bought one of those prayer canoes when I started practice. My Uncle Sam checking his net. Down on our trap line, down the coast. We came down fishing for the day. That's what I caught, 2 speckled trout. Going home that night. This is going out the bay, trying to get some fish. One of the islands. The Grand River at sunset, close to the river. One of my colleagues and his family, their daughter walked out. So we welcome non-Indigenous physicians, obviously, to the community, and they become part of the community. It's great. One of my other colleagues, he came out for a boat ride with me and my uncle. The colleague there, previous, came for a picnic. Also picnic, nice healthy French fries and speckled trout. At the bay there. Took my selfie last summer. Fishing. We had a nice catch of fish. My colleagues, we went hiking along the coast. We have a really good team up there. We all like the outdoors. We're sitting in a goose blind here. Picnic. That's my grad present from med school. My dad made me school. You're a little skinnier now. Road hazard in northern Quebec. The kangaroos are around every year. This is a kindergarten, grade 1 and 2 class in P1 on the West Coast. As a resident, I got a chance to go up with other Indigenous midwife, nurse, a dietitian, and a speech language pathologist, and we went up the coast to see the schools and talk to high school students and primary school students about being in healthcare. So it was really fun. They featured me on CTV News in Sudbury, and they did a kind of a before and after story. It was quite nice to see. And after that came on, I got recognized. I was working in Children's Emerge, and I was treating a Cree woman and her daughter in the Emerge. And you could hear the daughter say, "Hey, that's Dr. Kitty. She was on TV." So you might expect as Indigenous physicians you're going to be asked to do things like that. And it's a great opportunity to teach others about who we are, what we do, what our career aspirations are, and where we're going to be practicing. And all these kids, they wanted to be doctors at the end of the day. It's really funny. Means being in Fort George, over picnics. That's how Crees cooked their steak on a big stick on a fire. It's very good. And I had a big old ham and cheese sandwich. Chicken sense. And that's it.